The study, conducted by a research team from Beth Israel Deaconess Medical Center, BIDMC, and published in the Journal of Experimental Medicine, found that the dead and dying cancer cells created by chemotherapy trigger inflammation, which in turn promotes aggressive tumor growth. In this study we demonstrate that chemotherapy-generated debris from dead and dying tumor cells can stimulate tumor growth, which has pivotal implications for the treatment of cancer patients, said Deepak Panigrahi. The study's lead author and an assistant professor at BIDMC's Department of Pathology. Conventional cancer therapy designed to kill tumor cells is inherently a double-edged sword. This research reinforces what the medical community has known since at least the 1950s, but it is the first study to try to determine the exact molecular mechanisms that cause this phenomenon. Researchers have long understood that there is a distinct link between inflammation and cancer. A study published in the journal Nature in 2010, for example, noted, recent data have expanded the concept that inflammation is a critical component of tumor progression. Many cancers arise from sites of infection, chronic irritation and inflammation. It is now becoming clear that the tumor microenvironment, the infrastructure supporting the tumor, which is largely orchestrated by inflammatory cells, is an indispensable participant in the neoplastic process, fostering proliferation, survival and migration. So, inflammation causes cancer, the medical community is aware of that. But here's the kicker, the BIDMC study found that chemotherapy causes inflammation, which is why it is a double-edged sword. The very treatment that kills the cancer cells simply causes more to grow. And, not only does chemotherapy create cancerous tumors, but it actually spreads cancer throughout the body. A study conducted by the Albert Einstein College of Medicine of Yeshiva University, published in the journal Science Translational Medicine, found that chemotherapy causes a dramatic increase in the number of cancer cells circulating throughout the body. The researchers concluded that chemotherapy, despite decreasing tumor size, increases the risk of metastatic dissemination. So, just to be clear, chemotherapy creates cancerous tumors, and then circulates cancer cells around in your body. That does not mean that those battling cancer need despair, however. The BIDMC study also uncovered some extremely good news. Resolvins, molecules which are naturally produced by the body, can halt this inflammatory process, preventing the growth of new tumors. Resolvins actively turn off inflammation and stimulate a class of immune cells to digest the tumor debris left in the wake of the cytokine storm. In this study, resolvins suppressed lung and melanoma metastasis in mouse models, the scientists found, and blocked cancer growth in various tumor models including lung, pancreatic, lymphoma, breast, prostate, and melanoma. When the researchers administered chemotherapy and resolvins to a debris-stimulated pancreatic cancer model in mice, the combination resulted in tumor aggression. The researchers recommend adding resolvins to the existing regimen of chemotherapy and radiation, but how is it logical to subject cancer patients to treatments that do nothing but cause and circulate cancer? Why not just use the resolvins to get to the root of the problem and reverse the inflammation that causes cancer? A study published in the World Journal of Clinical Cases found that omega-3 polyunsaturated fatty acids, omega-3 PUFA, which are found naturally in fish oil, are associated with reduced inflammation, since resolvins are the active metabolites of omega-3 PUFA. Prevention is always better than cure, and those who truly want to prevent cancer should focus on preventing and reversing its cause, inflammation.